Coming to you from Southern California, this is Mindset, mental health news and information. I am your host, James Curtis, on today's show.
Kimberly Leonard calling from U.S. News and World Report.
I have a conversation with two guests, one of which is Kimberly Leonard. She is a reporter for, as she stated, U.S. News and World Report. She talks about in her October article, which you can find at usnews.com and on our Facebook page, Mindset Show page on Facebook, the idea of how exactly Obamacare, the Affordable Care Act, is working, specifically when it comes to mental health issues and coverage and the like. Then I also have a conversation with a mental health or a healthcare navigator. Her name is Linda Wright. She works in Southern California, and she works with the California Exchange, but she has some really good tips and ideas about navigating, signing up, what you should look out for, and how to generally approach it. But before we get to any of those stories, which you can find on our website and on our website, mindsetshow.com, as well as our Facebook page and our newly minted newspaper, The Mindset Report. First, these stories. Mindset Report is available at mindsetreport.com. The Mindset Report, your most comprehensive online source for mental health news. Today's Mindset Report is underwritten by Responsibility, a complete guide to bystander intervention by Alan Berkowitz, who is committed to the idea that the solution to health and social justice problems requires that we engage as bystanders. Responsibility is available online at lulu.com. Lulu spelled L-U-L-U. From Time Magazine at time.com, you can add another stressor to the financial burden of losing your job. Being unemployed, it seems, as is no surprise to anyone who's been there, can change the very nature of your personality, surprise, surprise, making you significantly less agreeable, changing your level of conscientiousness and openness. This, according to a new study published in the Journal of Applied Psychology. That study asked more than 6,000 Germans to self-evaluate 5 of their core personality traits: agreeableness, conscientiousness, extroversion, neuroticism, and openness. This from Psychology Online. Wisdom from long married couples appears to have a lot of wisdom for those, especially for those just starting out in relationships. Posted by Carl Pimler. He is a PhD psychologist and professor of human development at Cornell University. The top 3 things that are most important for relationships: 1, can we be friends? 2, do we like each other's family? And 3, can we talk about everything? Or are there, as he puts it, certain demilitarized zones that are simply off limits? Brian Williams has been in the news about his either failing memory or false allegations or false stories about his participation in reporting on the Iraq War. But could Brian Williams's memory have been playing tricks on him? That is, could he be a victim of what's called a false memory? Reporter Tara Parker Hope explores that question in the February 9th article that appears in the New York Times. For more on these and other mental health stories, visit Mindset Report at mindsetreport.com. We're back with our main topic, dealing with the Affordable Care Act and mental health, in about 60 seconds. Welcome back. You're listening to Mindset, Mental Health News and Information. I'm your host, James Curtis. On today's show, we talk about the Affordable Care Act, and the timeliness of this discussion is evidenced by the idea that, or the fact that, this coming Sunday, the 15th of February here in the United States, is the deadline for what's known as open enrollment. If you do not have health care coverage, the law now requires that you have it. Whether your state has its own exchange, as we do here in California, under Covered California, you can find that at coveredca.com, or your state has not elected to start up its own healthcare exchange, but you need to go through healthcare.gov. You can also find that at that website, and links to all of the things we refer to here on Mindset on our Facebook page. The idea is basically the same. You have to take certain steps to make sure that you get the coverage, you get it in a timely manner, and it's the best you can do to make sure that it covers the things that you, given your particular personal situation with respect to not only physical health, but certainly mental health, is addressed. I had the opportunity to speak with Kimberly Leonard. She is a reporter with U.S. News and World Report from her offices in Washington, D.C. earlier today. She authored an article, great article. Again, you can find that link on our Facebook page back in October, about basically how the Affordable Care Act is working in relationship to mental health care. Here's that conversation. The good and the bad about the ACA with respect to mental health. What's working and what's not working so good?
Well, what the act did is that it expanded care to a lot more people, and that includes mental health care and behavioral health care. And what that means is that more people are getting access to the care that they need, and that it's provided under their health insurance plan. Now, the problem with that is that there are some plans that still have not taken on these essential benefits that they're supposed to do under the law. They have a little bit of flexibility about when they can accomplish that. So some people might get health insurance and may not see those benefits kick in until later on. They still, however, will get some benefits, and being covered by health insurance will help them along the way.
One of the things that you point out in your article, and that is the October 29th issue of U.S. News and World Report, although there have been a flood of new patients to doctors' offices and hospitals under the ACA, that people with mental health issues and substance abuse disorders have not seemed to follow suit. There aren't as many of them coming out. Talk about that.
That's right. When I looked at this story, when I went in to write it, I expected to see a number of patients really go toward these services that are now provided for behavioral health care under the Affordable Care Act. And when I started looking at the data, I saw that the opposite was happening, that there was really no move in that direction. Experts do expect that it'll pick up, but right now, we're just not seeing a big flood of patients, and that has to do with a variety of different factors, including, first of all, that some people might just not be aware that these services are provided under the Affordable Care Act. They may be in a state where Medicaid has not expanded to cover people who are low income, and so therefore they might not be able to access health insurance because they can't afford it. They also just might be in a healthcare plan that isn't providing it just yet, because certain health plans have a little bit of flexibility as to when they can reach the requirements of the health law. So we're really looking at a variety of factors that are impacting whether someone is accessing the mental health services they need under the Affordable Care Act.
Are there any signs that the administration is doing anything to, at the very least, get the word out to folks who may be eligible for coverage but just don't know it?
The Department of Health and Human Services and members of the administration are working very hard to get the word out about enrollment. the deadline for this second open enrollment is February 15th, so that's coming up this Sunday. There have been numerous campaigns to make people aware, and whether people are shutting it out or whether the message is not being received for whatever reason, the administration is reaching its goals at this time, but they want to cover as many people as they can to make this work. So some states have their own exchange where they can log on and see what they qualify for, and other states default to healthcare.gov, which is run by the federal government.
Another item that you talk about in your article is the Mental Health Parity and Addiction Act of 2008. The idea behind the act generally being that mental health should get the same level of service as physical ailments. Is the administration doing an equal sort of push, like the one that you just mentioned about getting the word out, to try to make that parity more of a reality?
I really haven't seen that as much, I have to say. I've seen them target specific ethnic groups, and I've seen them target young people. There does seem to be maybe a lack of communication happening on that end. It's on healthcare.gov, it does specify that people can receive mental health services under the Affordable Care Act, meaning that your insurance plan now has to cover those aspects. And it's difficult because a quick check-in with your doctor over a prescription is going to take less time than a 50-minute therapy session. And so how all of that gets reimbursed is a little bit complicated, and whether they're on the same level is still kind of being figured out.
And one of the issues along that line, as you observe in your article, is that many mental health professionals who are in private practice don't accept Medicaid, and they don't accept some of the Obamacare, or in the cases where states have their own exchanges, that type of coverage.
That's right. That's why a lot of people go in and pay individual checks for therapy. It's very common for a lot of people who work in behavioral health care to prefer individual payments that way.
Now, is that just a business decision as far as you can tell?
I believe that the people who choose to take individual checks versus going through insurance or going through Medicaid are just trying to run a viable business, and that if the reimbursement that they're getting is not equal to the amount of time they're putting in, then they're unable to provide that service. Now, there are a lot of health insurance plans that are increasingly starting to offer those services, and there is more awareness around mental health, and there is a bill in Congress right now that has been introduced to address a lot of the disparities that exist in helping to treat people with mental health and substance abuse disorders.
Look into your crystal ball for us and give us your best thoughts or your best guess about what's on the horizon for the ACA in light of this Republican-controlled Congress.
I think that we're going to see a lot of argument over the Affordable Care Act, and with Obama in the White House, we are not going to see any repeal of health insurance, which means that people will be able to continue to receive some of the benefits that they've been getting. There are some people that are unhappy with the insurance that they have. They might feel that they are not getting the benefits that they expected. They might discover that they are paying higher deductibles than they thought. It's really important for people to review the details of their health plans and know what they really can afford and know what is covered. We do have the Supreme Court case coming up. There have been some issues raised around the plaintiffs in that case, and I'm not particularly sure what will happen, but experts tell me that the White House should be concerned. However, given some of the recent revelations, there might be some changes in the tide, and that would mean that people would continue to receive the subsidies that they had qualified for.
All right. Kimberly Leonard, U.S. News & World Report. She's on the web at usnews.com, where you can find her stories and other stories about healthcare. She's a healthcare reporter for the news division at U.S. News, and you can follow her on Twitter at LeonardKL. Kimberly Leonard, thank you so much.
Thank you.
We're back with more on the Affordable Care Act and how do you navigate? How do you sign up? What are the pitfalls? We're back in 60 seconds. Welcome back to Mindset, Mental Health News and Information. I'm your host, James Curtis. On today's show, we're talking about Obamacare, the Affordable Care Act, and how it intersects, how it lines up with how do you get mental health care coverage out of that. We're going to go into the nuts and bolts of signing up with a healthcare navigator. And although her name is Linda Wright, and although she is a California Affordable Care Act under our Covered California exchange, which is part of the Affordable Care Act, the things that she talks about and the information that she gave me about what you need to watch out for, how do you make sure you keep your same doctor if you've never had coverage before, and in the second part of the interview, how it actually lines up with when you take all those mechanics into account, dealing with aspects of mental health care, whether it's day-to-day issues like workplace stress or something going on in the home to more severe issues that require higher levels of care. There's just some really good information. Before we get into that, I want to give a shout out to all of my new Twitter followers, and I'm going to give you specific shout outs by name in the coming weeks. I meant to do that today. I apologize, but I will certainly get to that next week. But thank you so much, all of you, for your support. And the other thing about Mindset that I want you to know, Mindset Show, you can find us on the web at mindsetshow.com. We have a new online newspaper, the Mindset Report, at mindsetreport.com. Come out. You can support Mindset Show. If you go to mindsetshow.com, you'll find a Support Us tab on mindsetshow.com, and there are a bunch of different cool things that you can do, anything from vitamins to electronics to cool t-shirts for Valentine's. My favorite of all the t-shirts, it's actually an anti-Valentine sort of message, even though you can find the mushy traditional ones as well. My favorite, this will all end in tears. My guest, from Right on Time Youth and Family Services, Linda Wright. She is a healthcare navigator. You can find her at oopsimaparent.com. And here's how we started out our conversation, dealing with the mechanics of signing up and what that entails. I hear the term, and people who listen to the news and are keeping up with this issue, or even if you're not really keeping up with it, you hear the term navigator, and you are one of those people. You are a navigator for Covered California. What does that mean?
That simply means that I have gone through a rigorous course of study to understand the Covered California mission, the products, how to work with people and show them what the products are. We have to determine their income, how many children they have, and where they live, and all of that determines what kind of package they can get. I navigate them through the various products so that they can choose. I don't choose HealthNet or Kaiser or Blue Shield or whichever one. They have to choose the one that they want. So I navigate them through the whole system, and then they make wise decisions on their own. The other part of navigation is to let them know that there are copays and what those copays are. There are deductibles, and what is a deductible, and those kinds of things that are very, very important, because what happens is people will buy insurance, and then they go to the doctor or they end up in the hospital, and then they've got 20% to pay. Well, what does that mean? And so with what I do, they know what those things mean before they buy the product, and that helps them make a choice.
Now, a lot of folks that are getting coverage under the Affordable Care Act, and if you're in California, under Covered California, are individuals that either haven't had insurance for quite some time, or in some situations are getting insurance for the first time. Is that right?
That's correct. Absolutely.
So those kinds of basics about how the mechanics of the process, how those work, and how you deal with keeping track of your expenses and where you go to get services, medical services, and staying within your plan and that kind of thing. Those sorts of basics are paramount. Those are critical.
Absolutely, they certainly are. And when I and all of the other certified enrollment counselors and navigators, what we are trained to do is teach the person how to look at a particular health care product. They can find doctors, they can find pharmacies, they can find dental and vision, and find a person that meets their needs. When if a person has already had insurance and they love this particular doctor, I make sure that that doctor will take the plan that they choose. So let's say they choose a Kaiser, they choose a Blue Shield, or they choose a Blue Cross, or whichever one they want. Call your doctor, find out if that doctor will work with that insurance company. If they don't, then you have to make a decision on finding another doctor or finding a health provider that will take that your doctor will affiliate themselves with. So it's not that I get them to sign up for something and then they're lost. They have some homework to do. I rarely, if ever, have them just sign up the moment that I see them, unless they don't have a doctor, and if they don't have one, then they can pick. But if they have a doctor, I may have them make some phone calls right there in my office. We've run into that, and that's why I do it the way I do. I will have them take another 5-10 minutes right there in front of me and call their doctor. For instance, some doctors will only take an HMO. Some doctors want a PPO. Some doctors want an EPO, and they won't take an HMO. So the plan that they choose has to be an HMO or EPO or PPO, and it has to meet the criterion for their particular physician. So it's just an extra step that good navigators and CECs will do, and to make sure that the consumer gets all of their needs met. Not that they just get the insurance, but their doctor that they currently have will work with them in that plan.
Now, you mentioned the term CEC, and I see on your presentation it says Linda D. Wright, CEC, quote, navigator. What does CEC mean?
CEC is a certified enrollment counselor. And as I said, I had to go through a tremendous amount of training for that the first year. And then the second year, you had to be retrained and tested. So, and then I became a navigator, which is another term. And it's more extensive training.
One of the hits on the Affordable Care Act was the idea that the promise of being able to keep your own doctor really wasn't true. Are there situations where, even though a doctor is in a particular plan, they use HMOs or PPOs or whatever the case might be, because it's under, for example, Covered California or another part of the Affordable Care Act, if you're in a different state, you still can't get back to that same doctor?
Well, it's up to the doctor. The doctor can be a part of the exchange, or they choose to not be, and that's why the extra step is vital. If you want to keep that doctor, you may have to pay a little bit more so you can be out of the network, which a PPO and an EPO you can get a doctor outside of the network, but you also have to ask your doctor if they will accept it, because some doctors choose to not. And that's what happens if you lose your doctor, it's because they chose to not be a part of Covered California.
So the best first step that anyone can do or take when you're looking at being part of one of these exchanges, whether it's through the federal government directly, if your state doesn't have its own exchange, or if you're in a state like California and other states who have their exchanges, and in California it's Covered California, start with your doctor.
Start with your doctor. Ask your doctor. If you're part of Blue Shield, will your doctor take Covered California Blue Shield? If your doctor is part of Blue Cross, ask your doctor, will they take Covered California's version of Blue Cross? And find that out first. Then you sign up.
Is going through that process difficult? I personally found it a little bit daunting, and I've had insurance before, know just at least a smidgen about the process, but I still found it quite challenging. And
that's why you use people like me. I work through Right on Time because we're a subcontractor with the CEE, the Certified Enrollment Entity. I know that we'd love to have people go on the computer and just do it. But if you feel a little uncomfortable, contact one of us. Get a certified enrollment counselor to do it for you or do it with you, because there are some nuances. You can answer no and you should have answered yes, or you could answer yes and you should have answered no to a question. So it's not that the questions are tricky, it's just that the meanings for the insurance agency and for Covered California, the answers may be wrong.
No, Linda, they're tricky. They're just tricky. It's not.
I'm trying to be diplomatic. They
I understand. I don't work for Covered California or the Affordable Care Act. I'm not an insurance person. They're tricky. That very thing happened to me when I was going through the enrollment process. I went online, answered one way, and then I ended up calling because things didn't come out like I thought they should. And I should have answered another way. Unfortunately, the individual that I ended up talking to with, in my case, Covered California, was able to go in and fix it. But
yes.
Do you think it's a good idea in light of that experience and those types of experience, even if you think you know what you're doing, call somebody like yourself, call a navigator anyway, to have them double check or make sure that you're doing it right?
Absolutely, and that's what we're here for. And let me tell you one other thing that's wonderful that people don't know. We don't get paid by the consumer. They don't have to pay us 1 red cent to do the application. It could take an hour. Mine usually take 15, 20 minutes because I've done it for so long. But we don't charge for our service. And if we did charge, call the police because we're not supposed to.
Okay, that's good to know. What's the next most important thing that people need to be aware of?
The next step is pay your premium. Pay your first premium. Now, you probably can't do that for about 2 weeks, maybe 3 weeks at the most, but pay it. Get that application effectuated so that you can get the service that you need. It's not enough to pick your plan and then just forget about it. You pick your plan and you pay your premium. Then you choose your doctor. You make an appointment so that you can get your first checkup. That's the next thing. Get your first checkup because there's preventive care that's extremely important. So pay your premium, choose a doctor, see that doctor as quickly as you can so that if something comes up or if something is going on that you didn't know about because you haven't had insurance for 6, 7, 8 years, it can be dealt with right away.
What happens in a situation where I went through Covered California? I found out after the fact that I could no longer use my doctor. I was quite upset. I tried to fix it myself, couldn't. Ran out of time, got busy. I just didn't have time to deal with it anymore, so I just left it the way it was. I ended up actually going to the doctor that they had assigned me. Hated it. Now what do I do?
Find another doctor. There has to be another doctor in that network.
So
whichever insurance company that you've chosen, there's some doctor that you will find that you'll just really, really fall in love with. You don't have to stay with the same doctor. You do have to stay with the same insurance company until open enrollment again.
And Linda goes on to talk about taking responsibility for your health care, keeping track of what's going on with you. If you have diabetes, if you have high blood pressure, know the meds that you're taking. Have a list of them. Don't just refer to, I'm taking a blue pill or I'm taking a pink pill. Know what's going on with you. The more information you can give your doctor, your health care provider, according to Linda Wright, the better your health care will be. We move on to mental health. Let's move into mental health.
Yes.
The idea of individuals who have mental health care issues, which, dare I say, is probably everybody, but who have certainly, and not necessarily, serious psychotic episode type of mental health issues, but the more run-of-the-mill, day-to-day stress, going through divorce, dealing with my children, the kind of things that you work on through your organization. What does the Affordable Care Act and in California, Covered California, mean in terms of opportunity and expanded availability of those types of services?
I'm glad you asked that. There are 10 essential categories of health benefits that are required now through the Affordable Care Act. One of them is mental health and substance abuse services. The first one is hospitalization. We've got prescription drugs. We have maternity care. We have rehabilitation and care, pediatric services, emergency services, preventive and wellness. But we also have mental health. There are so many people with PTSD, with just issues of living, domestic violence. There are services now that are mandated through the Affordable Care Act, and mental health is one of them.
And what does that mean to someone? Say, for example, we've got a lot of our veterans that are coming back dealing with issues. Their families are dealing with issues. How is that, or how should we, or how should a family factor those kinds of issues in to going through this process? Well,
first, I know specifically about Kaiser, but now the health care products now have to have a mental health component. So you have to have psychiatrists on board. You have to have psychologists, LCSW, MFTs. I'm giving you acronyms. Marriage and family therapist. LCSWs are licensed clinical social workers. You have to have those people on staff so that they can deal with the kinds of mental health issues that come forward. Family issues are extremely volatile in these days. We've got children that are having problems and they're in probation. We have domestic violence. We have child abuse. And that's one of my specialties because I'm a retired social worker. But all of those people have to be handled and worked with so that they can become more secure and have a safe and nurturing home for their families.
A lot of people, because of the nature of stigma and mental illness and mental health, haven't dealt with a mental health care provider before.
That's true.
Unlike a situation where I've had a doctor before, I've gone to this individual, I've dealt with them, I know I like them. If I'm starting from scratch with a provider for a situation, for an issue having to do with mental health, I wouldn't necessarily have the same starting place, would I?
No, you wouldn't. You wouldn't have the same starting place. But the stigma, the shame, the guilt, those are things that we have to overcome. And in order to make our lives improve and improve our families' lives. So if you're feeling depressed, if you're feeling alone, if you feel abandoned, if you have these kinds of feelings, the best thing to do is to call your provider and see if you can get an appointment with someone in the mental health area. Because talking about it and sometimes getting on some kind of psychotropic med is the best thing, especially for the short time until you get into groups and start talking about the issues and problems.
I had the opportunity to talk to one of the executives running the Aetna mental health care side of their program, and one of the things that he told me, which actually surprised me, I had no idea that this kind of thing existed, was that you can actually have conversations over the phone with some healthcare providers about mental health issues to try to figure out what to do about it, where to go, and what you should do next.
And they call that triage. Yes, that's absolutely true. Now, I don't know, I have not talked to all of the various healthcare option providers to find out what their process is. I do know that Kaiser has an excellent program and they have mental health facilities in various parts of the community. So it's outside of the hospital, and they strictly deal with adult mental health problems and children's mental health problems. I imagine that all of the other ones do too, because it's mandated.
So, as you mentioned early on, the idea of figuring out, when we're looking at keeping your own doctor, talking to the doctor to see if they accept a particular plan, is a similar approach about mental health care advisable. That is, look at the plan and see if they have triage services, or see what kind of availability or what types of products that they have for mental health.
I would think so. Yes, absolutely.
What, for people who haven't had to do any of this, and I think, again, because of the nature of stigma of mental health, about mental health, a lot of folks haven't had the opportunity to go to therapy, go to counseling, to get the services of a licensed clinical social worker or a marriage and family therapist. What's your advice when you're dealing with a new process, a new type of program, may never have had health care before in general, and now you add on top of that having to deal with a situation where you've never had mental health care before?
What I do is I talk about the 10 essential services, naming all of them and including mental health. So it's not as if I'm just bringing that up as if there's an issue with that particular family. Once I go through the 10, and the mental health is probably the last one, and substance abuse that I mentioned, if it brings to their mind or to their thought process that maybe that's something that I need to think about, and yeah, I do have an issue, and my son is ADHD or whatever the problem is, that's when I will, because I work in this field, that's when I will talk to them about contacting one of the healthcare products and finding out what they have to offer before they make the decision to choose which healthcare product that they want to have.
Now, that brings up another point, and that is, in choosing a navigator, is it okay to ask if your navigator has some sort of or a mental health background?
I think it's okay to do whatever makes you comfortable.
So, a person, they're calling up, they're calling some 1-800 number in their particular state, or they're calling the exchange, the Affordable Care Act exchange, if their state doesn't have their own. How give us an idea of what they should say or what an individual might say. How do you put that? Because it's one of those things that's it's uncomfortable. I mean, especially if you've never had to do it before.
Well, it is uncomfortable, and I'm not sure how the exchanges would handle those kinds of questions. Mm-hmm. I know I can give you my number, and I can give you the Riverside County Black Chamber's number.
All right, well, pull those out and give those to us whenever you're ready.
Okay, well, let me give you mine for right now. It's 909-223. 8535, 223-8535, and the Riverside Chamber is 888-607-0222. Now, we make sure that the navigators that are on our staffs are sensitive to the needs of people, and we get even more training. We meet periodically to talk about the different situations that come up on the phone. Now, there's HIPAA laws, and we can't talk about somebody's name and what have you. But if there's a circumstance that comes up, and we want to make sure that everybody can handle that particular circumstance as it comes up with them, we will talk about that in a general sense. But we all have different expertise. Mine just happens to be in social work and treatment and therapy.
Okay. So give me your best suggestion. I know I'm putting you on the spot here because we hadn't talked about this kind of issue, but I'm an individual. Not only have I not had health care before, or perhaps it's been quite a while, I've never really talked about the idea of mental health care. I'm on the phone. I'm talking to maybe not somebody who's as sensitive and well-prepared as you are, Linda Wright, but someone who's a navigator. What might I say?
I would talk about, without elongating the particular problem, that in my family history we have some mental health concerns, and I want to make sure that Blue Cross or Health Net or Kaiser or Blue Shield or whichever, LA Care, that they have people on staff that can address my issues.
That is Linda Wright. She is a healthcare navigator. She runs Right on Time Youth and Family Services. Even if you're not in California, she said you can give her a call. Thanks to my guest, Kimberly Leonard, U.S. News and World Report, as well as Linda Wright. You can find links to all of the information we talked about on today's show on our Facebook page, facebook.com/Mindset Show page. Until next week, for Mindset, mental health news, and information, I'm your host, James Curtis. Dare to see mental health differently and pass it on.